Okay, I'm here with Leah. Leah is doing a Theramonial interview for us. Thank you so much for being here, Leah.
Yeah, thanks for having me.
Okay, awesome. Let's go ahead and get started. I'll read off the first question. So, Leah, what made you curious about therapy in the first place?
I would say it wasn't so much curious as it was a little bit mandated. I went twice. So my first experience with therapy was when I was really young, I think 12, maybe 13. And that was mainly because I was having a lot of panic attacks, which would later turn out was a misdiagnosis. They weren't panic attacks. And then I went recently again when September, I had essentially a psychotic break. And so it was recommended that I go to counseling. And then from there, I got classified as high priority, medium risk. So what that kind of entailed is about 8 to 10 weeks of free therapy. And since I hadn't had a positive experience with it before, I was a little hesitant to go back into it. But I talked to some friends that had used the Texas Tech system, and it sounded like that was a little bit more of a positive experience. The other thing too is like I'm now a fully realized adult versus like a child with no agency. So I kind of knew going into it that I could stop it if I didn't want to go. And essentially I needed something to cope. I was way out of control in terms of managing my life and managing my bipolar.
I see. So, the first time around, kind of feeling like you were a kid who's like the adults in your life were kind of making you participate in therapy. Is that right?
Yeah, and it was just kind of terrible. Like my therapist would have sessions where it was me and my parents in the room, and then there'd be sessions where it was one-on-one, but then she would tell my parents what we talked about. So that would be the bad experience in therapy.
Yeah, that can be really, really hard. Because, yeah, there's another ceremonial of a kid who would have been right around the same age as you were. And one of the first things he kind of helped him know that he was safe was that his therapist said, listen, unless you're doing something really dangerous or talking about doing something really dangerous, this is I'm your therapist, and I won't tell anything to your parents, without talking to you first and letting you know. So that it's just that safety factor. It's really.
Yeah, and part of why I kind of wanted to go further in this one is you had your, I don't know what else to call it, but like, sorry, dogs. But you essentially had what was called like an intake session. Hopefully that helps. An intake session. And when I was like in that intake session, they were really clear about what and what did not get reported.
Okay.
And what was not considered confidential. And so that made me feel a little bit more secure and going. And then they were also really clear about the fact that I could stop going if I wanted to, right?
Yeah.
Because some of the concerns I had, especially with my condition, was like there's a lot of involuntary kind of mandatory counseling, group therapy sessions. And I was worried too about being hospitalized. So those were concerns.
Yeah. So you corrected the question. Like it wasn't a curiosity. It was, and you used the word mandated. And at the same time, there's kind of a difference between the two experiences. And I love how you said the second time around, you were a fully realized adult. You still, at the end of the day, you had a lot more control, if not pretty much complete control over your therapy experience versus when you were, a preteen. But yeah, that fear, especially around the specific diagnosis of bipolar, that if on those lows, if suicidality is coming up and fear of hospitalization and all those things, that is very common and a real barrier for a lot of people to seeking any sort of treatment because they're just afraid of that, what did you say? Involuntary, can't remember the word, but that hospitalization, that kind of can't remember what word you used, but yeah, out of your control, losing control, it's a real barrier of fear. So,
Yeah. And I think part of what made me comfortable was this idea that I could fire the therapist if I needed to. And by fire, I mean, like, I could request a change, I could
uh-huh.
not go there. So there's a little bit more freedom in terms of who was providing care.
So what was it like when you first reached out or first kind of initiated the process of seeking treatment?
Sure. Would you like me to talk about both times or most recent?
Whatever you're comfortable with.
All right. So again, the first experience was pretty bad. The reason why I ended up going to the first time was because I was having panic attacks and I was self-harming. And that freaked my parents out, obviously. Starting that was terrifying. The one emotion I really remember is that I was really scared. It got to the point where when I went there for the first sessions, all I would do is just like cry because I was so stressed out to be there.
Mm-hmm.
And I felt like I was being punished in a lot of ways. Like, if you do these behaviors, you're going to have to go to therapy. And, instead of like swim class or theater or whatever, that became my extracurricular. And it sucked. It was also not talked about in my family. So it became kind of like a stigmatized thing. Like, no one would bring it up. No one wanted to talk about what was happening. They wanted the deets, but they didn't want to like work with me in
Mm-hmm.
terms of coping strategies or just being kind of comfortable with what was happening. The whole time it felt really scary, and I remember feeling like really guilty about being there. Second time, I was a little stressed out. It was around the time of the Kavanaugh hearings, and so there was a bunch of publications about that. I highly suspected my psychotic break came from that situation because it was related to trauma, right?
Yeah.
And it kind of sucked going back into it because part of like making sure you get the correct treatment and get paired with the right person is you have to disclose a lot about how you're feeling, right?
Mm-hmm.
Or like what your symptoms are, how you're acting.
Yeah.
Which meant like I had to disclose to a lot of strangers that I had trauma in the past, and they would keep asking you questions about the trauma.
Yeah.
It didn't come from like a bad place. It was a place of like trying to understand, what might be causing the
Yeah.
symptoms. But man, it got exhausting. Especially since my first intake person was a man, and I did not feel comfortable talking to him. But at the same time, it was a long waiting list to get in. And so it was kind of like, I can talk to this guy, or I can wait another 4 to 8 weeks. And so that wasn't an option at the time because I was in a really bad place. And then it got kind of weird because he started crying and I didn't cry. And so I felt like I almost had to like comfort the intake guy. It was very strange.
Yeah. So this took a lot for you to just kind of initiate the process and then move through the first stages of the process. And the way, what did you say? You had to disclose to a lot of strangers all these, intensely personal experiences, and not from like a place of it's in the past and I can tell the story, but this is what's like actively happening for me right now with lots of different external triggers, bringing everything back up. So how you said that your first intake counselor, so did you have to go to more than one intake and then ended up with a therapist that you worked with longer term?
So there's a couple of variables. I had come into the therapy already having psychiatric medications.
Okay.
And because of that, they referred me to the psychiatrist, where I had to do an intake there. But for counseling, it was just the one session. And from there, they gave me a full psychologist versus, say, like a, what is it called? Like a grad student training, right?
Yeah, student therapist, yeah.
Yeah, so I got a full psychologist, which amused me.
It's a compliment. Take it as a compliment. Yeah.
Right. I was high priority, VIP for therapy.
Yeah, VIP. So you had to kind of move through a few stages and then ended up with, did you say psychologist?
Yeah, I had a psychologist.
So how did you know that that person was the right fit for you?
I didn't at first. In fact, at first I was really like, ugh, because I don't know. I'm always kind of, I have my own like preconceptions of what a therapist is, right?
Sure.
And I was like, I swear to God, if I have to do adult coloring books, I'm gonna lose it. And you walk into a counseling center, and it's almost hilarious because in terms of decoration, it feels very much like we're going to represent all of the elements, and it's going to be very calm, and everywhere you look there's brochures and coloring books and stress balls. And so from that initial impression, I was like, shit, this is going to not be for me, because I'm not a sensitive person by any stretch of the imagination. I'm not a creative person by any stretch of the imagination. So even just like the words, journaling, coloring books, anything like that kind of makes me not super into it.
Like side eye, like what you just did.
Oh yeah, major side eye. It was total side eye. And then I walked into the office and it was more side eyeing, right? Because they had like the stereotypical couch with like a throw rug over it, lights that were low lighting, so it was like super ambient kind of vibes that they were going for. And I was just like, it's going to be one of those people who talk to me. And the first session, you don't really get to know your therapist, right? It's kind of just your therapist getting to know you and why you're there. Mm-hmm. So I figured I would give it like 2 to 3 times because I got 8 to 10. So kind of in a dark humor sort of way. I had plenty of trauma left for someone else if this one didn't work.
Cool. So decided to give it a try, despite kind of lots of cues that this maybe wasn't going to be like a great, I don't know, like personality or vibe fit.
Yeah, like vibe or maybe culture, because like I have like a knee-jerk reaction to things like people telling me to self-care or mental wellness. I think those are kind of shitty frames. So anytime I see something that kind of supports that culture, I get a little uncomfortable. But I just remember like the first thing that made me like, oh yeah, this is someone I want to talk to. She said, you don't have to do adult coloring books. And it was like unprompted. And so I was like, thank God. So that was a good sign for me to like continue with this person.
Did she just kind of volunteered that? Was that in like the first session or?
It wasn't the first session because the first session was mostly just me talking about stuff, right?
Yeah.
And then the second session, I think we focused on, gosh, it's been a while. I think it was focusing on like coping when you have severe depression. So just little things like how do you brush your teeth when you're in a terrible place? It might have been like the third or fourth session where we were talking more about, I guess I'd call them like daily things versus big picture things.
I see. Yeah. Okay. So maybe that was part of how you knew she was a good fit, is that she could kind of pick up on who you were and what your culture preferences are and what might be good for you, even if it's not what worked for her personally or for all of her other clients. She was able to read that and say, just kind of offer like, listen, you don't have to do any of the stuff that you see here.
Yeah, and I really like that she framed things in ways that were like, this is an option. Try it for a week, and if it doesn't work, we'll find something else to kind of pursue. I like the flexibility of that. Yeah. Especially since my first therapy experience was very mandated.
Yeah.
Part of that probably is like, I don't know, it felt like the atmosphere when I did the first time was more like, we can control the kid. Now, like I said, I feel like I got a little bit more say in how I want my treatment to go. And I think she kind of respected what I was and was not comfortable or ready for, which I thought was good.
That's awesome. That kind of collaborative approach rather than let's fix you, you're the problem.
Yeah, it was very much like, what you're doing, like, you acknowledge that what you do isn't working. So, like, I volunteered that first. It wasn't like she incited that or anything. I was like, I've been trying to get a hold of this for like 15 years and it's not happening. And she's like, all right, so if it's not working, what are some things you would like to see change? And then from there, we kind of started, I don't know if I want to call it brainstorming because she had it on hand, right? But trying to fit a coping strategy to what I needed help with.
Awesome. So this kind of carries over into the next question, which is what was most helpful. And so far you've talked about kind of her kind of meeting you where you are and assessing what you've tried, what hasn't worked, and offering things that might work, like what has maybe worked for other people, or, you know, is research supported. What else was helpful for you?
I guess the first thing is her taking time to listen about what I thought my diagnosis was. I had a hard time getting diagnosed with bipolar, and that's pretty common. It's a really hard thing to get diagnosed for. Because kind of like the default is you have anxiety and depression because that's ups and downs, right? The first time I broached a doctor about having bipolar, it was literally a 10-second conversation before they gave me meds for depression. And with SSRIs, that makes bipolar a lot worse.
Yeah.
And so that made like a really kind of painful year of my life. So I think just the fact that she was willing to listen about what I thought I might have had was important. And also the fact that she was like, we're going to wait until we make any kind of claims. That was really comforting. And at the time I still am seeing a psychiatrist and a psychologist. And so the psychiatrist had his own ideas about what might be going on, and the psychologist had her own ideas. And one of the things that the psychiatrist kind of pitched the first meeting, I didn't, kind of shocked me. It didn't quite fit with what I thought was happening. And so I brought it to her, and she was just like, yeah, this is not how I would diagnose this particular thing, especially after like an hour of talking to you. So I guess what I appreciated was the idea that this was going to be an extended conversation rather than a snap judgment kind of thing.
Cool. So, gosh, 10 seconds versus an hour, right?
Yeah.
And so she just kind of heard you out. You had ideas about what your diagnosis might be, and she just gave you space to kind of flesh that out and support that curiosity and not assert her like professional expertise or anything, but just let's keep that in mind. Let's kind of expand, let's work together, but also not jump to a diagnosis right away. Kind of keep it a little open-ended, as long as that made sense, right?
Yeah, I think what the main difference was between, say, a clinical experience and a therapeutic experience is I felt like my personal narrative was valued more in the therapeutic. Psychiatric or medical, it's always been about the symptoms. How do you treat the symptoms? And it feels kind of curative, right?
Yeah.
Like, we're going to throw meds at you until some combination works. And that's the end of that. Whereas with therapy, it felt a little bit more like, tell me about your experiences with these things versus symptoms, which is a small but important distinction to me.
Oh, for sure. And yeah, that idea, like you say, that curative approach where this is a problem that needs to be fixed, and until it's eliminated, we're failing, kind of. And therapeutic is experience based, and kind of your opinion is an important factor. And maybe it's not about eliminating so much as, I don't know, kind of accepting and managing and kind of moving along in your life even while they're present, without the sole focus on curing.
Yeah, so especially when you have something like bipolar, that's not going away, right? And you can treat symptoms as long as you want with medication, but that's not always going to be effective. It's going to change. I think the narrative part was important to understanding what was happening. and validating too.
Yeah.
Because I have gotten so many dismissed claims, not just from professionals, but in life and in other people in other positions of authority, like teachers, right? Or coaches or whatever. And my family too. Even with the diagnosis, they're still like, you don't have it. And I'm like, I do. So it's helpful to just kind of have someone understand that you kind of need that validation, I guess. Because it's important, I think, for people to have validation in their experiences and to acknowledge that something's been difficult or wrong, right? I don't think that happens enough.
For sure. Gosh, for sure. And it sounds like for you, having like a words to put around your lifelong or 15 plus year experience was really, really useful. You used the term narrative, like to be able to have something to kind of point to and say, this is what's happening to me, or this is what's kind of part of my world, was really useful. I wonder if there was any part of kind of seeking that diagnosis or being given that diagnosis that felt something different, that wasn't just like soothing and helpful.
I mean, honestly, when you feel like you're crazy for thinking you're crazy, it's a big relief to just kind of know that what you're experiencing has grounding, right? Like it's not something you're making up or something you're using to explain another situation in your life, or a lot of thing that comes up with like mental illness narratives is that it's an excuse, right? And so the main thing I felt was relief. It was a big cathartic moment when I left my therapist, and she's like, yes, I'm thinking bipolar too. Just to, one, it gave me more confidence in pushing back against medication that was not working for me. Mm-hmm. So like with Paxil, for instance, which was the SSRI I was on, my doctor, like general practitioner, would not listen to me when I said it was making it worse and would just keep upping the dosage. So by the time that I finally quit Paxil, which I felt confident in doing so because I had that support, I was up to, I want to say 40 milligrams a day, and it had been over a year. That's like ridiculously high. Yeah. So it was extremely painful to get off that medication. And with that, I was very angry for a long time because it caused a lot of unnecessary pain just because someone wouldn't listen to experiences. And so, yeah, it was a relief. And it was confidence boosting in a way too. Like, it gave me kind of ownership of my identity in a way that I hadn't had it before.
Yeah, for sure. Like that self-trust was reestablished. Like you said, like the crazy factor or that, that level of crazy, you could kind of move through that and cut through that and validate yourself. And like you kind of knew all along, but when you have professionals and like you say, all these other people with authority in your life saying, no, it's this or that. And all along thinking like, I think it's something else. And then to get some validation around it. Yeah. Like you said, that relief, that comfort, all of it.
And I think one thing that therapy is good too is the extended nature of it. There comes to a point when, because every time you go to an appointment, it's always like, how are you feeling? What are you doing? Like those types of questions. And I always felt like I had a shit time explaining what these things were, particularly in relation to depression, right? Because everyone's like, well, are you feeling sad? And I'm like, I'm not feeling sad, but I'm feeling depressed. Like these are different things.
Very different, yeah.
And I always felt like I was describing it in a different way every time. And that made me kind of worried. I'm like, are they going to think I'm making stuff up? Are they going to think that like, this is, making stuff up, being uncredible, that kind of thing. And so by having it kind of long term, I think it was easier to talk about it in terms of patterns, which was really important, especially with something like bipolar, where you definitely have patterns. So that was more helpful, I think.
Yeah, for sure. That, and just that relationship between you and your therapist, it got off to such a good start, you know, where she could kind of ease some of your concerns right away and just be there with you and have that consistency where she's not looking to do anything quickly. You know, she's just kind of holding the space and building that relationship and observing alongside you things like patterns and symptoms and all of that.
Yeah, and as sad as it sounds, when you get into a depressive funk, and for me at the time, it was lasting months, like months of depression. Having a regular appointment where you were accountable to somebody helps you get out of bed. And in some ways, that's what you need.
No, for sure. The structure of therapy, just in and of itself, you know, to know that there's an appointment and there's a time that's predetermined, you know, an amount of time that's predetermined, and then the legalities and the ethics around it. So, you know, there's a, you know, very, very small chance that anything will leave the room and that it's very, very safe and contained. It really is a powerful structure. And you're not the first person by a landslide, you know, that I've heard say, like, if it weren't for therapy, I wouldn't have left my house for months at a time. Cool. So you touched on what didn't work when you were a kid, and you kind of touched on why you prefer working with a therapist versus a psychologist. I wonder if there's anything in your therapeutic relationship, you know, with the psychologist that that hasn't worked or has felt like it got in the way of your healing.
Well, first round, obviously, lots of problems. I've been calling it phase 1, right? Phase 2, there were rough patches, but I think that the rough patches were from me wanting a quick fix, and that just doesn't happen. A quick fix, I wanted to be able to have like 2 weeks and be ready to rock, and that's just not how things go. And so a lot of me going back to therapy was kind of learning that, where I had to learn that, you know, to get out of a depressive episode is something I'm going to have to deal with my whole life. It's not something that's going to be fixed or healed or cured or whatever. And I think that there's this kind of expectation that when you go to therapy, you're going to walk away with so many coping skills and you're going to be so healthy and it's going to be great and you're going to be a better person. And I guess I was surprised to find out, like, there's a lot of destructive shit about me that I didn't consider. One thing we talked about was like anger management. I never thought I had an anger problem, but like talking through it, I was like, oh, I'm kind of an angry person. So I guess it's not so much the therapy as it was me adjusting to therapy. Like adjusting was really hard, especially when you got other shit going on, right? It's like, learning coping strategies for my anger is great, but I need to be able to teach this class tomorrow or pay my bills on time or, you know, whatever. So the adjustment period was kind of frustrating. Not because of anything that my psychologist did, but just because I had to get acclimated to the way it works.
Sure. Yeah, really. I kind of accept that it takes time and it takes consistency over time. And I mean, balancing all of the resources that have to go into therapy, you know, your time, your energy, your emotional and mental space with everything else it takes to just live your life, you know, to pursue your work and your schooling and, like you say, you know, pay your bills. I mean, just all those things that take so much time and mental space and energy and emotional space and all of those things. Do you mind clarifying if you're still seeing a psychologist now or if that's ended?
So let's see. I started late September, early October, I think. I think it was October where I actually got into a room with my actual therapist. And I went until mid-January. So it was like 8 weeks total. And it got to the point where I was the one who decided to stop going. It wasn't like oh, your time's up, right? It wasn't a situation like that. And I stopped going, I think, because I didn't want to talk about the deeper problems. I wanted coping skills from my thing. I didn't want to like uproot trauma, right? I was like, I don't want to talk about my family, really. I don't want to talk about my past relationships. What I want is how to move forward with stuff. And so it got to the point where once we were done talking about, I guess I'd call it the surface level things, I felt like I had nothing left to say. And so it was kind of hard for me to want to fill that space up with talking on my end. And I felt like I had a couple strategies that would be good for life outside of therapy, right? And I had been implementing a couple of them, and I was seeing better results. And so that was, for me, it felt like a good stopping point. When I broached kind of stopping, or I guess pausing, right? Because I'm not naive enough to think that I won't go back one day. But it was with the understanding that I could come back anytime I wanted to. So like if I had another instance where I had major effects on my life, like I did in September, October, it'd be fine to come back if I needed to.
I see. So kind of feeling like you got what you came for a little bit, like I got skills.
Maybe got what I was ready for.
Yeah, exactly. Which is actually, I mean, such an important part of healing and connecting with yourself and rebuilding self-trust is, you know, moving along at the pace you can manage, and that's what you can manage. So you said that you're pretty sure like your time in therapy isn't over for the rest of your life, and at the same time you felt really kind of clear that for now this is what you can do, this is the kind of help that you are ready for and you're going to use, and then eventually either feeling kind of like that mandated idea again, or maybe kind of a deeper level of readiness, you know, to go through the trauma work. You'll be back.
Yeah, it kind of feels like getting through all the trauma stuff would be like running a marathon, and I got to learn how to just jog, right? So I'm just jogging right now.
Yeah. And I mean, that training takes a long time, you know, so take your time. Okay. So you can answer this last question as addressing like your 12-year-old or 6 months ago self, or both. But what would you tell your pre-therapy self?
Well, younger me, I would tell them that I guess the big thing is you have the space to push back. I think that's important. So I did not feel that way. And I guess in that certain situation, it probably wasn't that way. But that was kind of a lesson I learned between the 25-year gap of oh god, I can't do math, 15-year gap between going as a kid and going now as an adult. Is just this idea that you can push back, you can quit when you want to. As a kid, you don't really get that, say. So that was kind of my prep talk, I guess, in going back into therapy. I needed to kind of reassure myself that I could quit if I wanted to. In terms of pre-therapy, for the 2.0, I guess one thing I would maybe encourage is to be a little bit more vulnerable than what I was. I think when I started, I was pretty, not confrontational, but I wasn't necessarily open to a lot of things. And I think that's just because I had a really shitty experience. So I guess had I known what I know now about my therapist and about how it would have worked, I probably would have felt more comfortable being more forthcoming in the earlier sessions, when I wasn't. At one point, my therapist said, like, I've only seen you get, like, really emotional maybe once. And that was when I was going through my Paxil withdrawal. That was probably the only time I was, like, emotive, I guess would be the word I would use.
Sure. I know it's so easy, to look back and be like, God, I could have gotten more out of that or done more with that. And at the same time, I mean, how are you supposed to know, that you
Right. I'm not qualified for this.
No, I mean, we can't see into the future, so you had to do what you did to stay safe and to maintain that kind of individuality and integrity as an adult, that this is under my control. I can move at my pace. I can quit whenever I want. I can stay safe. And you just, you had to kind of do what you had to do. It sounds like you're kind of thinking about, as you move forward in your life and next time you're in therapy, like maybe you can afford to be a little bit more vulnerable or take a little bit more of a risk because you have so much practice now with reading the situation, and getting to know, like, the office doesn't mean the therapist is a certain way, or
Mm-hmm.
how she handles her life doesn't mean she's going to force you to handle your life that way.
Yeah, she had a metaphor that I think works pretty good. Like, your issues are like a pit, and you gotta get the topsoil off first before you can dig into the pit. So I feel like I've gotten topsoil cleared off. So next stage will be the rest of the pit.
And it probably feels pretty good though, just to have that topsoil cleared off.
Yeah, it was kind of funny. So I don't know if this is common or if it's just a thing my university does, but they had, like, God, what was it called? It was like a risk index or something. And so when you start therapy, you fill out like these little Likert scales, right?
Yeah.
Like, on a scale of 1 to 5, how suicidal are you feeling? On a scale of 1 to 5, how much are you seeing shit, and so on, right? And so you have that as like your starter. And then at the end of therapy, she's like, do you want to see your risk your risk index or whatever it was? And I was like, yeah, because I'm a nerd and I like graphs. And so it was really funny when it was like 3 stages. Top was red, right? That was like high risk. Yellow was like, and then green was like, you're great. She was like, anything in the red is clinical. And I looked at it in like every category but one. I was like clearly in the red, like 98 out of 100 and that kind of thing. And she's like, now we got you in the yellow. And it was just kind of funny to see that my bipolar was color-coded, I guess. That was kind of an interesting thing. But it was also like a really clear way to see what was happening with my mental state. And as much as it kind of amused me, it was also kind of comforting, I guess, in a way, to see that like my stress was going down.
For sure. Yeah, those measurables can be really, really valuable. Either a scale or, a questionnaire, whatever it is, to be able to compare yourself, from beginning of treatment to end, or, beginning to middle to end, whatever, but to see that difference over time.
Mm-hmm.
So much of this is so abstract, so much of emotional and mental health is subjective and by feel, and to have a little bit, like you say, kind of concrete numbers can be informative and soothing.
Yeah, and I think that was just another way that she responded to my personality, right? Because I'm pretty blunt, and I appreciate it when people are blunt in return. And so it wasn't like, I'm going to hide these secret numbers from you. The other thing was like, I'm not going to hide what I'm thinking your diagnosis is. I appreciated that a lot, and I felt like that was her kind of responding to what I wanted out of the experience.
Yeah, cool. Good. Well, thank you so much. Thanks a million for answering those questions. And I just really, really, really appreciate you sharing what you shared. So thank
Yeah,
you.
no problem.